بسم الله الرحمن الرحيم.
Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. This is your brother Raymond Elias, and MEC, Muslim Endorsement Council, has asked me as a hospital chaplain to share what I do in the healthcare setting in preparation for Ramadan and during the month of Ramadan and caring for Muslim patients, family, and staff. And so I think that happens in two main ways. The first way is in institution and relationship building. And so being a staff chaplain, you are part of the spiritual care team. You are part of the interdisciplinary team, along with social workers, along with physicians, along with nurses and other staff members. And so there is a sense of being able to create a special opportunity to create awareness in the hospital setting. Just as we in the United States recognize other faith traditions and their holidays in the hospital setting, it's important to recognize the needs of Muslims, especially during the month of Ramadan. And so that can occur in terms of collaboration with other departments, including nutrition services, to order the dates and the water, to be able to work with volunteer services to put together Ramadan gift bags that have dua booklets, that have maybe a gratitude journal, that maybe have some cards from local Sunday school of a masjid that has some inspiring words of get better soon, inshallah, Ramadan Mubarak. And you should see the faces of these patients and families that they're surprised, and then there's joy that they see that there's someone thinking about them, that there are these resources available to them, not only these Ramadan gift bags, but realizing that I didn't know that you guys had Quran speakers for us. I didn't realize you had these spirituality booklets for us. Didn't realize that there were prayer rugs and markers for the Qibla in the chapel. All of these types of things that create a sense of awareness, not only for the institution, but also for Muslim patients and staff and families who may not be expecting these types of items within the hospital setting that's for them and to meet their needs. And number two, I'd be remiss if I didn't recognize the spiritual themes that are also there in the month of Ramadan. For example, there can be a sense of loss, multiple types of loss. Number one, those family members who have passed away and were here last Ramadan, but they're no longer here. And so there might be a sense of grief. And in the United States, there's a cultural understanding or a societal understanding of something called Blue Holiday, that the holidays are usually a time of joy, but there can also be a sense of sadness when we remember our loved ones who are no longer here. And then there's also a person who's maybe not able to fast this Ramadan. Maybe they're going to be in the hospital all of Ramadan. They're not able to engage in Taraweeh and the usual types of worship and ibadah that they're used to. And also, there are those who maybe get a new diagnosis and they're not going to be able to fast at all. And so that is something new, and there is a period of grief that they must go through that is natural. And so to be able to, as a Muslim chaplain, bring the seerah of the Prophet ﷺ to them to show how he grieved, to share that hope and inspiration from the Quran, to be able to maybe reframe some of the topics, to be able to reframe some of the ways that they might be coping, and be able to provide a listening presence, to be able to hold that space with them, to be able to hold those tears with them. And so that is part of some of the work that we do as Muslim chaplains in the hospital setting. We ask that Allah subhanahu wa ta'ala bless MEC, Muslim Endorsement Council, and all their initiatives. We ask that Allah subhanahu wa ta'ala bless those who are sick. May Allah grant them shifa and afiyah. May Allah subhanahu wa ta'ala accept all of our ibadah in this blessed month of Ramadan. Wassalamu alaikum wa rahmatullahi ta'ala wa barakatuh.